Went really smooth. I was very impressed with the staff who handled it, right from the nurses right through to the physio. Hi, my name is Rick Houston. I'm a retired police officer, police labor relations executive. I'm the first ankle replacement surgery at the Chatham-Kent Health Alliance, and I'm very proud to say that and pleased to say that.
My name is Hans Hunt. I am an orthopedic surgeon here at the Chatham-Kent Health Alliance. Been practicing for just over a decade here. My subspecialty focus is in foot and ankle procedures, although I am a generalist and do lots of knee and hip replacement surgeries, as well as fracture treatment, the rest of it. Whenever there seems to be a complicated foot or ankle case, it tends to come to me, and that's where my expertise lies. And I'm starting to expand that by introducing an ankle replacement program here at Chatham-Kent Health Alliance.
I retired quite a few years ago, and I've tried to enjoy my retirement, and I keep fit by walking 9-10 kilometers a day and aqua fitness. And about 3 years ago, my ankle really started bothering me, and it got progressively worse over that period of time. I was getting shots. I've seen various doctors. Nobody was giving me a solution. And my rheumatologist recommended the last opportunity maybe to have this looked at and dealt with would be an orthopedic surgeon.
The procedure of a total ankle replacement, it entails, right now for me, a single night in hospital stay, the standard preoperative investigations, going through pre-admit, depending on comorbidities or other health issues may involve being seen by an internist, much like our hip and knee patients would go through. The surgery itself, it takes anywhere from an hour to 2 in the operating room, and then they would recover on the surgical floor for that evening. I'm treating them in a cast or partial cast for at least the first 2 weeks, and that just allows the ankle to be immobilized, allows the wound to heal well without the strain of motion. And then within 2 weeks, that cast is removed. And if there was no other surgeries or procedures that had to be done concomitantly with the ankle replacement, often at that point, they'll be converted directly either into a walking boot that they can place all their weight through, or even start physiotherapy without any walking aid at that point. Now, a lot of my other colleagues, particularly the ones that trained me in the procedure, they're doing this as a day surgery where the patients can go home the same day. And it's my hope that as I get a few more of these under my belt and a little bit more comfortable, if patients fit that criteria, that they would be able to go home the same day. Certainly a lot of my other large foot and ankle procedures are being sent home the same day with great success.
My role during the first total ankle replacement at CKHA was the scrub nurse role. I was in charge of setting up the tables, making sure the instruments were in order, and having them in the correct order. I had a couple sales reps and other doctors helping me throughout the entire case, making sure that I had everything in order for myself and Dr. Hunt.
That morning in the operating room, the teamwork was awesome. We had reps come in that helped us. We also had Dr. Hunt who taught us everything we needed to know, as well as a surgeon who came in and assisted. But everyone worked as a team, and I think it made the procedure go smoother.
The teamwork was huge during this first total ankle at CKHA, because without everyone there, we would not have been able to do it. Everyone had their specific role, and with everyone coming together so well, it just made the day flow so smoothly.
I think it's very important that patients can receive care locally and in their own community for several reasons. It's important for a patient-family care model because to go out of town for a surgery, especially if you're talking about the Greater Toronto area, 3 hours drive, that's a big burden on patients or often their family members who have to take time off work to drive them there if they're elderly and not able to make it on their own. These procedures, it's not a single appointment and you're done. There's a lot of follow-up involved, for several months. And so there could be multiple visits over the course of 1 to 2 years, and that's a big burden on some families, and particularly caregivers of the patients. So being able to offer those things here and in Chatham for Chatham residents, or even people in the direct surrounding area, I think is of utter importance. I have nothing but the best things to say about my colleagues in the OR, and I'm thankful for the support that they offer me.
When my ankle's fully recovered, I'm going back to a lot of walking, a lot of trail walking. Both in Kent and Essex County, there's a lot of great places. And Point Peely, places like that, Rondo, and I'll be out there putting a lot of kilometers on. Thank you to everybody at the hospital for all of the wonderful care.